Today we will be explaining you about CVS. By CVS we mean Chorionic Villus Sampling, जो कि फर्स्ट ट्राइमेस्टर के एंड में किया जाता है. Amniocentesis we do after 16 weeks, whereas before 14 weeks we do Chorionic Villus Sampling. अब इसमें हार्डवेयर क्या क्या यूज होता है? सिंपल हार्डवेयर है, कुछ ज़्यादा नहीं है. सबसे पहला और इम्पोर्टेंट इसका हार्डवेयर है, ये है 18 गॉज की स्पाइनल नीडल है. And we use this spinal needle to break the placenta, and we aspirate the chorionic villi with the help of this needle. We make sure that we do not puncture the amniotic membrane. This is a 10 cc syringe, normal syringe with a local lignocaine 2%, and this is another syringe. It's a Liverlox. It's not normal syringe. It's a Liverlox syringe. This is used to aspirate. While we put the needle, the spinal needle in the placenta, we use this needle to aspirate. It's a very simple procedure. I will explain you as we do it. This is the fetus. You can see this is a urinary bladder. This is a placenta. In this case, the placenta is on the posterior side. It's on the posterior side. It is not an easy good thing to have. Ideally, we would like the placenta to be on the anterior wall. If it's on the anterior wall, it's easy for us to go and take the CVS samples. Whereas when the placenta is on the posterior side, it's difficult for us to take the chorionic villus sample. But since it's in the early pregnancy stage, still it's manageable with the patient positioning. And now the first step in the procedure is cleaning and draping the patient. We clean the patient with 10% betadine twice in a inner to outer fashion. And then we drape the patient in a sterile with sterile sheets with a small hole in it. And then we also clean the probe with the stereo. Here you are tilting the patient to one side so that we can get an access to the placental tissue from side. Now after tilting the patient to the left side, we can see that we have got a window from here. From the right of the patient, we can go into the placental tissue. Now next step will be to give local. While giving local injection, we should make sure that first we inject local in the subcutaneous plane. Then we pull the needle. We are doing an incline technique. We are doing an incline technique. We put the needle just adjacent to the knot of the probe, just in the subcutaneous part, and then we inject local subcutaneously because skin and subcutaneous tissue is painful. After that, under ultrasound guidance, we go inside and then we lead local up to the uterine wall. Bas ho gaya, slowly. Always remember, before injecting, we should always aspirate. You should always aspirate and then inject. ठीक है? दर्द तो नहीं हो रहा? After injecting local, we should wait for at least around 2 minutes, 1.5 to 2 minutes for the local to take over. ठीक है? दर्द तो नहीं हो रहा आपको? बिल्कुल भी नहीं हो रहा ना? Now we can see our needle tip is in the chorionic tissue. Can you see the needle tip? See? Now we will remove the stellate of the needle and take the syringe. With the application of negative pressure, we move the needle back and forth at least 10 to 15 times so that we get good chorionic tissue. Here we are making sure that we are in the placental tissue. Second thing is that we are not puncturing the amniotic membrane. Before that, this point of time, amniotic membrane is not fused with the surrounding uterus. See, I think you are able to see the needle going back and forth so that we get a good ample amount of chorionic villi. That once we get the sample, this is how the sample looks like. Then we will put the sample in the culture media. It's a specialized culture media which is dedicatedly made for chorionic tissues. Once the tissue is collected in the media, we'll allow it to settle for at least 1 or 2 minutes and see the chorionic tissue at the lower end of the Repeat.